Hello everyone, I hope you're okay. Welcome to another video. My name is Bright Mulenga and this is Health Tips. So we've not had videos on health tips for some time now due to unforeseen circumstances, but here it is now. So due to popular demand, we decided to bring back Joe Kanema from Farmers with People's podcast. So in this video, we're going to talk about the use of Sildenafil, or simply Viagra as it is commonly known. And sometimes it's also known as the blue diamond or the blue pill. So over to you, Mr. Joe Kanema.
Thank you for yet again another opportunity to do a presentation today on this important topic. We couldn't do this episode earlier enough as we had planned because I was diagnosed with COVID-19 and I've been in isolation for about over 2 weeks now. But thank God I'm fine, and I want to thank my family and friends for the support that they've given me. But we're here now, and then we'll be able to do this presentation. So today we're going to be talking about Viagra, which is one of those important topics. But before I do that, I want to encourage everybody to head over to YouTube and please subscribe to the YouTube channel Bright Mulenga to get such content like this. So actually, the scientific name of Viagra is actually Sildenafil. So Sildenafil actually comes in a pack of 50 milligrams. It comes in a pack of 25 milligrams tablets. It comes in a pack of 100 milligram tablets. So it was initially designed to treat hypertension in the lungs, that is pulmonary hypertension, by the pharmaceutical giant Pfizer in the United States of America. But then now it is mainly indicated for erectile dysfunction. So how does Viagra work? So Viagra actually simply increases the flow of blood to the penile region. So this results in penile erection upon sexual stimulation. So it might be important to note that Viagra cannot work unless there's some form of sexual stimulation. And it is also important to note that Viagra does not prolong any sexual activity. So how do you take Viagra? So Viagra is actually effective, much more effective if it is taken between 30 to 1 hour prior to any sexual activity. So the drug is actually well absorbed in the tummy, that is in the tummy, if it is taken after a fatty meal. So you usually advise clients to take it with a fatty meal to improve its absorption. So there are some important things that can be noted before you take Viagra. So some of these important things ensure that your renal system is functioning just fine before you take Viagra. This helps to ensure that it's not accumulating in the body, which can cause all those side effects. The other important thing to note is that your liver is functioning just properly. So ensure that your liver is functioning properly before you take Viagra. And if you're an elderly patient who is above 65 years, so ensure to take it with precaution because it causes all these different side effects that comes about. And if you're hypertensive, if you are taking drugs called nitrates, ensure that you take precaution before you take Viagra because of the interactions and the side effects that usually occur. So what are some of the side effects of Viagra? So there are a number of side effects, but the notable one for the sake of this presentation is that they cause headache. That's like the number one culprit. They also cause nausea, diarrhea, and dizziness. So moving forward from the side effects, there are about two important things to note before somebody takes Viagra. So if you're anemic, so Viagra causes a side effect that is called priapism. So it is quite rare, but it occurs. So priapism is actually prolonged erection that usually stays for about 4 hours or so. So it is prolonged erection. It is a treatable condition, but it's quite painful and uncomfortable. So this mainly occurs in people who have anemia. So before you take Viagra, ensure that you get advice, especially if you're anemic, because it might cause priapism. Another important thing to note is that it's also rare, but it usually occurs. It's cardiac risk. So before you take Viagra as well, ensure that your heart is functioning just properly. I'm sure you've heard of stories where people say, no, somebody died on top, or something like that. So this usually occurs. So how does this occur? So this usually happens because of the excitement or the exertion from renewed sexual activity, which actually leads to hypertension, and it may lead to bleeding in the brain, and it can lead to heart failure as well. So it is important to always take precaution. Uh, Before I conclude this presentation, I want to note that Viagra is actually a prescription-only medicine here in Zambia. So before you take Viagra, ensure that you see your medical doctor, or if you feel or you know that you have erectile dysfunction, ensure that you see your medical doctor or your pharmacist to be able to advise you on how you can take this medication. And I want to thank you once more for being able to listen and watch this video. Until next time, thank you.
So thank you very much, Mr. Joe, for the presentation. It was really helpful and very educative. I hope the viewers have learned something. Thank you very much for the support, and also for liking and subscribing to the channel. If you've not subscribed, please subscribe, and also leave a comment in the comment box below, and give a suggestion of what topic you'd want us to talk about next time. Thank you. Bye.